Hello and welcome back to Maternity and Me. In this video, I'll be outlining your options to stay most comfortable during labour and also the options that you have for the delivery of your baby if you have diabetes in pregnancy. In the previous video, I introduced why you might be more likely to have an induced labour if you have diabetes in pregnancy. If you haven't watched this video yet, you'll find the link in the description box below.
When you have an induced labour, you are more likely to use an epidural, as the onset of labour pains is usually faster than for a labour which starts by itself, and epidurals provide excellent pain relief. You can have an epidural at any point in your labour, providing the anaesthetist is available. However, it is recommended that during the early stages of labour, you try to use other methods of pain relief and stay mobile. This can help to get the labour started. But you can be assured that your midwife will support you throughout your time in labour, helping you choose the best mode of pain relief. There are several methods which are available to you, ranging from gestational to having an epidural. I've put 2 links in the description box below if you'd like more information. When you have an epidural, it is more difficult to know exactly how and where to push at the end of labour, and you are more likely to require assistance from your doctor during delivery. There are 3 ways in which your doctor can assist with your delivery. Before any assisted delivery, your consent will be gained, and you will also be advised on the most effective way of providing pain relief to make the delivery as comfortable as possible. Ventouse is a plastic or metal cup which fits onto your baby's head. This is attached to a suction device, and during your contractions it is used to bring the baby's head into the best position for delivery and help the baby to come out. Forceps. These look like metal spoons which cradle around your baby's head. During your contractions, this will help to bring your baby out. Episiotomy. After pain relief is given, this involves making a small cut to increase the size of the vaginal opening so that your baby can be delivered more easily and to prevent more serious vaginal tears. After delivery of your baby, the cut is stitched with dissolvable stitches and heals over in the days after delivery. For more information about these methods, I've added 2 links in the description box below. Having diabetes in pregnancy does not necessarily mean that you will have to have an induced labour or a caesarean section, and the final say on how and when you deliver your baby is yours. Your diabetes team will work with you towards the safest delivery for you and your baby, which will depend on the severity of the diabetes, the growth of the baby, and other factors in your pregnancy and general health. You may be advised to opt for an elective, that is, a planned caesarean section. This may be if your baby is large for gestational age and you want to reduce complications during delivery. Or if your baby is in the breech position, feet first, or if the placenta is blocking the exit for the baby. Most importantly, in women with diabetes in pregnancy, a C-section may be recommended to prevent shoulder dystocia, which is when the shoulder of your baby becomes stuck in the mother's pelvic bone during delivery. To treat shoulder dystocia, your midwife and doctor will move you and the baby to try to dislodge the shoulder. This affects 1 in 100 deliveries overall, and it is more common in diabetes where the baby is large or has a large body compared to its head. This may have long-term consequences for the baby. Having a C-section is a surgical procedure which requires a 12 cm cut in the lower part of your tummy. You will usually be given an injection in the back, known as an epidural, which will numb you from the waist downwards. It is likely that you will still be able to feel the pushing and pressure from the procedure, but this should not be painful. You will also be given pain relief as required after the operation. some mothers who have diabetes in pregnancy who initially opted to have a natural delivery may have to have an emergency C-section. This can be if you or your baby are in distress, your labour isn't progressing, or if you had an induction but didn't go into labour. Even though it is termed as an emergency C-section, it will still be your choice to go ahead, and the labour ward doctors will explain the operation and recovery as part of making this choice.
I hope this video helped to answer some of your questions about the pain relief available to you for the delivery of your baby. If you'd like to know more about having a C-section, I've put in another link in the description box below. If you enjoyed this video, be sure to like, comment, share and subscribe to our channel to keep up to date on all the new videos which we'll be producing soon.